Conference will now be
Okay, I can slow
recorded.
down a little bit.
So I do got questions, probably part of this, but then part of other things too. It's like, for instance, yesterday,
on my
This
national
conference
registry
will
test
now
when I
be
was taking
recorded.
my EMT basic. But my question was like, you have a young male in the alleyway, he presents with meiosis and altered mental status. What's your like treatment plan? I had no idea what meiosis was, so I was like, the C looks good. And after I got out of the test, I Googled it. Meiosis is pinpoint pupils, but I didn't know that at the time. So it's really important for you to know terminology. So whenever you're presented with a question like that, you can be like, oh, meiosis is pinpoint pupils, right? So we're going to talk about medical. This chapter basically just tells you how to break down the words. We have a Cahoots after this because this is very short. And so you guys can play Cahoots for the first time. All right. So our objectives, we're going to identify the components of words, suffix, prefix, all that fun stuff. Directional terms, and then positional terms. We touched on the positional terms a little bit with the supine, prone, Trendelenburg. You'll see that again. They just reiterated. So compounds, we all learned in English, it's two or more words put together, right? So roots, usually the root of the word will tell you like what that word is referring to. And then we add a prefix or a suffix to kind of tell you what's going on with that area of the body, or like a specialist, right? So some prefixes that you're going to see, this, that means like difficulty with. So PNEA, meaning to breathe, like apnea, means no breathing. Dyspnea means difficulty breathing. So this means difficulty. Pnea means breathing. So tachy, what do you think that means?
Like a body kind of,
Trouble.
like fast distance.
It means fast.
Mm-hmm.
So fast breathing, right? And then we have suffixes. So itis, meaning inflammation of, and then iliac, meaning like somebody's having trouble with that. So someone that's a hemophiliac has a problem with it. And then arthritis is inflammation of the joints, because arthrith means joints. So then you get your specialists. So cardio, anytime you see cardio, that always means heart. Logy is the study of, and then ist is someone who specializes. So cardiology, the study of the heart. Then you have a cardiologist who specializes in the study of the heart. I asked the doctor once, I was like, who's in charge of the hospital? Like, if you have a patient, which specialist like tells you what's going on? And I was like, in my head, I was between cardiologist and neurologist, right? Because the brain or the heart. I'm like, that's the most important. They're like, no, none of those guys mean shit compared to the nephrologist. Apparently kidney people are like really important in hospitals. Don't give this med, because then you'll make them pee too much, or you're not going to make them pee at all. So nephrology or nephrologists apparently are the big coconuts, I learned. We also use a lot of acronyms in medicine. One big one that you'll see is CPAP. So we pronounce it CPAP, but it stands for continuous positive airway pressure. So you have a device called a CPAP machine, which you see a picture of right here. And what it does is it just forces air into somebody's lungs, kind of get more oxygen, get fluid out of their lungs, what have you. You'll see CPAP, you'll see BiPAP, DNR, we'll use DNR a lot. So acronyms. There's another sheet that I can hand out to you guys that has some of like common abbreviations that you'll see. All right, so dissecting a compound word. So, chole, meaning bile. Cyst is a closed sac. So a closed sac of bile. And then what is itis? We just talked about it. Inflammation of, right? So inflammation of a closed sac of bile. So what do you think cholecystitis is? It is gallbladder, yes. Good job. So, it can be kind of confusing, unless you keep seeing these things over and over again and like you keep exposing to yourself to certain words. It's kind of hard. Like cholecysticitis got me for a very long time. 'Cause I'm like, what's a chole? I don't know that. All right, so medical terms, we talked about this in a couple PowerPoints ago, but if you're talking to your patient, try not to use big, scary, long words. Try using like layman's terms to bystanders or your patient. And then, yeah, so if you walk in and you are like, yeah, I'm gonna sound really smart and I'm gonna use all these big, long words. And then sometimes even your like coworkers or other healthcare professionals are like, I've never heard of that. So
If you're gonna use them, you better use them right. Use them wrong, then you look like a ding ding.
yeah,
Don't look like a ding ding.
don't look like it. All right, so A&P, so anatomy and physiology. Anatomy is a study of where something is, so where it's located in the body. And then physiology is how things work in our body. So our next chapter that we'll be going over Thursday is anatomy and physiology. That one's super fun. Everybody's favorite.
I loved it.
Huh?
I did. I loved it.
Did you?
Yes.
Did
I
you?
freaking hate A&P. I had to take A&P before I could even start paramedic school. Like that was like the prerequisite to starting paramedic school. I was like, yep, this is where I failed.
Yeah, A&P stuff. Like anatomy's not that bad, but once it gets into physiology and they're like, okay, this is the sodium potassium pump and the Krebs cycle, I'm like, all right, so anytime we're talking about a directional term, you're always referring to the patient as if they were standing in an anatomic position. So the hands are out and the palms are forward. So if you're talking about like the anterior portion of the hand, it's gonna be the palm of the hand. You don't stand like this, you stand like this in the anatomic position. So that's what, like hands, palms out, but obviously refer to them. There's 100 different words for everything. So not just the anterior part of your hand, that's also called like your palm, right? So you'll learn those kinds of things. This is how they like to divide the body. And so how I remember them, so coronal plane, right, is your frontal plane that's in front of you. I remember that because you want a Corona, like a beer, sitting in front of you. So that's how I remember that. Transverse, I don't know if this is socially acceptable, but if you have a transgender, the bottom part's different than the top part. So it cuts you in half this way. And then your sagittal plane, if you think of like Sagittarius, he's holding a bow and arrow, so it cuts him this way. So that's how I remember those. Whether they're politically correct or not, sorry. That's just how it works in my brain. So medial meaning midline. So if it's more medial, it's more towards the center. If it's lateral, it's on the outside. So this is my lateral thigh. This is my medial thigh. Does that make sense? And then you also talk about it with like rotation. So you have lateral rotation, you're moving away, or abduct is also like away because it's being abducted from your body, or adduction, you're adding it to your body, or a medial rotation. Does that make sense? A lot of words getting thrown at you. So then we go into more directional terms. So bilateral meaning what?
Both sides.
Both sides. Good. If it's unilateral, it's what?
Single side.
One side. Now mid-axillary. There's a picture of it right here. Mid-axillary, right? Middle of the armpit. So this comes into play whenever we're talking about like placing a 12 lead, because the little sticker for V6 goes mid-axillary. So it's good to know where that line is. And then as you progress in EMS or any kind of medical field, whenever you start like needle decompressing or sticking your fingers in people's chests, we go mid-axillary. So we kind of need to know where that is. So we know anterior, we know posterior. If it's above, it's going to be superior. And if it's lower, it's going to be inferior. And that goes to like, when we're talking about like arteries that come into the heart, we have like our superior vena cava, our inferior vena cava. So it's talking about where it's at. Is it above or below? Even more confusing things. So if we're talking about away on the limb, so like your wrist is distal to your elbow. So distance, it's away from you. Now, if it's closer, my elbow is proximal to my wrist. Does that make sense? A lot of words. So a lot of times you'll hear like a distal humor fracture. So that means that, where would that be if it's a distal humor fracture? It's more towards your knee or more towards your hip?
Or towards your knee.
So distal, it's away. Distance. All right, so palmar, easy. We have palms of our hands, that's palmar. And then the bottom of our foot is plantar, right? So two different. Plantar, bottom of foot, palmar, and then the back side is dorsal for either your hands or your feet.
You got all that?
It's a
Maybe
lot.
test later.
It's a lot.
Not today.
Yeah. Right now. This is one of those things that we'll work with, like, whenever we're doing scenarios.
Listen, this is where things, and that's why we were saying, like, the last couple of classes, like, everything's boring, it's lame, like, blah, blah, blah. Things are about to start ramping up. I'm not gonna try to make your life super difficult, but as we progress, and same thing I told the last class, start using these words, even if you use them inappropriately, so I can correct you or Becca can correct you. The more you use them, the more familiar you become with them. So when we start doing scenarios, or you start running calls, or you're over in the ER talking to patients, when you come out and I'm like, okay, well, where was their broken leg? And you're like, oh, well, it was, a distal femur fracture. Okay, cool, right? Well, where was their, cut? Well, it was, proximal to this location, right? If you're using these words, we can either correct you or say, yeah, that's appropriate, right? So use them now as much as you can, and that's where the repetitive learning comes in.
Yes. It is a lot.
It is a lot, and it can get confusing, but the more you use it, the easier it becomes.
Okay, so mid-clavicular. What is a clavicle? Collarbone, good. So mid-clavicular, this confuses some people too, because some people think that our clavicle goes from here to here, right? It actually goes all the way up to our shoulder. So our clavicle, or collarbone, reaches all the way over to your shoulder. So if you're gonna go mid-clavicular, it's actually gonna be a little more over than you would think it is initially than just like looking at somebody. A good way that I find a mid-clavicular line, again, with the needle decompression, you just take your hand, put your thumb on your little notch right here. You take your pinky and touch your shoulder, then take your middle finger and bring it down. That's usually your mid-clavicular line. So it looks more over than you initially would think, but not this way. Mid-sternal, so middle of the sternum, right? So mid-sternal. And then we have our quadrants of our abdomen. So it is important to note, like if you're assessing your patient and you say they have right lower quadrant pain or left lower quadrant pain, it's important to note that because different organs sit in different places, right? So a common one that you'll see usually on a test is rebound tenderness in the right lower quadrant. What do you think that is indicative of? Appendicitis, right? What is rebound tenderness?
It comes out, though.
Yeah, so you push in and then as soon as you let go, they're like, right? And so our appendix sits right here. A big one, what's in our right upper quadrant? Liver. Yeah,
Gallbladder.
liver, part of our gallbladder, right? It kind of sits like right there. What about over here? That sits in our left upper stomach and what do you say? Spleen, yeah. So the spleen's a big one, right? Because it stores our red blood cells. So if someone has an injury to their spleen, chances are they're gonna bleed out, right? They're gonna bleed out in any of those quadrants, but, whenever we start going more into like abdominal complaints and that kind of stuff, it's important to know what sits in each quadrant. Yeah. If someone's shot in the right upper quadrant, you're like, okay, well, their liver's done.
We'll come back.
Yeah, or some patients like, that are like cirrhosis patients, you'll actually see their liver, like their liver's so enlarged.
Starts
you'll see it.
distending?
And,
Starts distending?
yeah, their stomach can distend and you can go in and like, you can actually feel their liver. Like some people that have like enlarged liver cirrhosis. If they're really small, you'll see it like poking out, but sometimes you can feel it too, like you can feel the line of their liver. All right, and then our diaphragm sits right above all that. So that's kind of important to know, right? So a lot of our organs that sit right up against our diaphragm, you'll have something called referred pain if they have some kind of infection in them. And usually that pain goes to like the right or left shoulder. Usually they say left shoulder. I've seen it both ways. So this picture should be in your book. So if you want to take another picture, but yeah, you can see all the things that we talked about. All right, what's this one?
Supine.
Good. What's this one?
From
She looks like she's so happy to be there. What's this one? Which one?
it's the
Left
right
side.
lateral.
Left
Left
lateral. Good.
lateral.
What's this one?
Fowler's. That's a
Fowlers. The difference between Fowlers is you're sitting straight up and the semi-Fowlers you're kind of leaning back a little bit. Do you remember that whenever we're talking about like position, like left or right, we're always going to be talking about patients left or right. So if they broke their left wrist, it's left wrist, right? That is so confusing. It seems like, duh, we're going to say that. But whenever you're sitting in the back looking at the patient backwards and you're like, yeah, it's their right arm, but it's really not. It's their left arm because it's your right. But it's always going to be patients, right? What's this one? Good. Do we use this anymore?
No.
Perfect. Like I said, very short. Any questions?
All right. So this is what I need everybody to do. Everybody have a cell phone? So, Cahoots. I think, Billy! Here. Listen, everybody in this class is subject to the mirror.
Here.
The Cahoots, is that an app? Oh, okay. Can y'all download the app?
Who in here played the?
I don't know.
We did it.
It's such a
year
great
last
time.
year.
I mean, y'all don't have as much use right
I
now
think
because
so.
Calvin's not in here. Last year, freaking Calvin spent half of his time hanging out because he was like, he was in his injury state, so he wasn't working. So Calvin would come and sit in the back of the class and beat everybody in Cahoots. So kind of was unfair.
Oh my god, it's gonna make me set up biometrics for my app store.
I'm going. Yeah, create an account. We'll use this a lot during class. That's the reason why I'm gonna go ahead and get y'all to download this because it's just like a fun way to kind of nail some of this stuff.
A little bit bummed at the, that's the best part of the movie,
Oh,
and then you go like, and then we go give you a pen. No, Jeopardy.
Did you pick your icon?
yeah, we like playing Jeopardy.
It's really funny, because like at the end of class,
it
we'll
just-
go back
it
over
brings
the
it
same
up
one,
and
and
you're
be like, oh, this is so easy.
Right.
Yeah. Listen, if anybody puts a name on here about their freaking feet, I'm gonna talk about you, because that happened last year.
What?
Yeah, yeah.
What's the pen?
That one, it's right.
Oh,
One of the freaking, I think it was Alex, put his, something about his feet up here last year.
Well, you would just choose a random person.
Yeah.
It'd be like, CJ's hair.
Yeah.
Yeah.
So, y'all have an unfortunate advantage on Austin because they're a little delayed, so.
I see that.
No, Billy can click. Billy can click. Go ahead and click, Billy. I mean, wait, we gotta get everybody signed in.
You gotta make it sound.
I didn't remember the sound.
If you can't see this screen well, you can feel free.
Yeah, the screen behind y'all are on. Might make it easier. You have a hard time reading some of this stuff.
What's that? Oh, great.
What do you think? Yeah. And there's just like a going thing for every one of our classes. Like ding ding's the
Wonder why.
everybody's subject to be called a ding ding at some point. Except for her. She just tries to choke me out. Y'all were here last year. She freaking punched me in the lip. I remember the fat lip for like 2 weeks. Billy remembers. Billy was there. I come in. Huh?
Do I repeat?
Yeah. You do? I got the recording. I'll find it on YouTube.
May or may not have been elbow, they came in contact with his lip. Would have been alcohol.
Y'all ready? Get your clickers ready. So you get points based off of how fast you answer and whether you answer it right or wrong. As we go through, we'll, we'll make it work.
All right. Define the prefix hyper. Oh, yeah, you have to look up here and then click on your thing. Very good, very good. So beyond normal or excessive.
Sorry, I'm still looking up data.
It's all right, practice. All right, Dr. Ding Ding.
I like it,
know who you
Picasso.
are. Which suffix means surgical removal? Best guess, best guess. Everybody got it. Everybody got it. Good. Dr. Ding Ding still leads. True or false? Nephritis refers to inflammation of the liver.
Ooh.
So it's false.
Not this
It is the kidneys.
Ah.
Right.
Said something else. Yeah, I'm looking at it for a second. What you talking about? Huh?
I feel better with this place.
Ah,
All right, so nephritis is inflammation of the kidneys. So anything neph is kidneys.
What's
I found
liver?
10 hours of Kahoot music. Don't worry. Find the prefix poly.
What is the prefix for liver?
For liver, it's gonna be like
Inflammation of the liver.
all right, so poly meaning many of, right? So
Yeah.
if you have a polyfarm overdose, what does that mean?
What?
A polyfarm overdose, what does that mean?
they took it
Farm?
a lot of different meds.
A different
Right.
meds,
Oh,
yeah.
farm,
So farm.
PH. I'm thinking
Yeah.
farm like animal.
I know, it
looks
like-
they overdose
They
on chicken.
took all the chickens.
They had
Look
so
at
many
all the
chickens. So poly, if you think about, whenever we start learning about like diabetic emergencies, you'll hear of the many P's. So polyuria, polydipsia, polyphagia. So poly means a lot of or in excess. The prefix dis means what? We just talked about this. You better give it. All right, 3 of you have some explaining.
It was a
Five
mispress.
of them have spleen.
Oh, 5 of them. Yeah, sorry. Apparently I don't know how to count. Mercy.
They were close together. I was
So
trying-
abnormal or difficult. So dyspnea means difficulty breathing. Good. All right. Bilbo's in the lead. Angina means what in medical terms?
Great.
All right, good. So chest pain caused by reduced blood flow to the heart muscle. Whenever someone's having chest pain that goes away with rest, it is referred to as angina. Ouch. I'm sure there's somebody else that pronounces it angina. I was taught
They're
angina.
wrong.
Yeah, it's okay to be wrong. True or false? Arthroscopy is a surgical procedure used to examine joints.
Who is that?
And now we're going.
Yeah. A lot of Maxwell.
All right, so true. So athro, like arthritis, right? Arthroscopy. And then scopy is like you're scoping it, you're looking at it, right? So examination of the joints.
I thought it was gonna be a trick question, like arthro instead of athro.
Oh, yeah, athro. Define the term hematology. So hema meaning what, and then tology meaning what else? Good job.
Isn't that bad?
Yeah, not too bad, not too bad. Now we're doing good. Define the term dermatitis. So derma, your core, itis, meaning. Nice, nice. I need to make this harder next
No, you're fine.
It's already hard.
time. Define the meaning of the prefix sub. So under, below, submarine is below the surface, right? So sub, below. Which suffix means blood condition? Okay, good. So emia, so anemia, right? That's a common one that you hear a lot. Anemia is like lack of red blood cells, right? So emia meaning of the blood. True or false, cardiopathy is another term for a heart attack. False. What's the other word for a heart attack?
Infarction?
Yep, myocardial infarction.
Cardio.
Death of the heart cells. What is cardiopathy, do you think? Study of the heart. Or disease of the heart, sorry.
Oh.
What would be study of?
Ology?
Yes, there it is. It's coming back to me. Blank is a term for a disease caused by insufficient blood supply. Okay, so ischemia is lack of oxygen to tissues. Whenever that tissue dies, it's called an infarct. So myocardial infarction, heart attack. So ischemia, hematoma, hema meaning blood, right? So that's not
Blood
to the
supply.
tissues, right? So hematoma, neuritis, NEUR,
You're wrong.
right? Some kind of inflammation or something. And then poly, we talked about. What is poly?
Many.
Many, right?
A hematoma is excessive blood to the area, like localized blood flow.
It's like a bruise.
Yeah,
like
a
swollen
gose,
bruise.
yeah.
Which suffix means inflammation? Y'all better get this one too. So close. Itis. So anything ending in itis is inflammation of that.
So stressed out. I hate this.
What is hyper?
Over,
Over.
What is hypo?
under.
Osteoporosis is a condition in which so osteo always means bone, right? So osteoarthritis, osteoporosis. Blank is a medical term for an abnormal increase in white blood cells. So leukocyte is a white blood cell. So an abnormal increase in anemia being of the blood, right? So leukemia, excess. Someone has a streak for 16.
Nice.
Which abbreviation stands for prescription? Good. That was easy. Too easy.
Themes.
True or false? Arthralgia means pain in the joints. True. So arth like arthritis, and then algia meaning pain. If your patient presents with hives and itching, what system is affected? Integumentary, hepatic, cardiovascular, or neurogenic? I always have pictures bigger. Good. So integumentary, whenever we start going through your medical sheets that we handed out at the beginning of class, that's one of the systems that you need to assess. So integumentary just means your skin, all of your skin systems.
That would be liver.
Yeah,
Hepatic.
hepatic is your liver, cardiovascular is what? What was the last one?
Nerve something.
It's brain, nerves and brain. A normal SpO2 for your adult patient should be what range?
Oh.
95 to 100. Does anybody know what it's called when it's less than normal?
Not epoxy.
So less meaning hypo, right? So hypo, and then oxia is hypoxia. So hypoxia.
What's epoxy?
Hypoxia, it just means low oxygen. Billy, you're being the best clicker. Thank you. What does nephrectomy mean? Did anybody put finger? Who put finger? Because I put a picture of the finger up there. Yeah, I tried to get y'all. It worked. So nephrect, your neph is your kidney. So nephrologists study, like somebody who studies the kidneys. So ectomy, meaning removal of. So appendectomy, removal of what?
The appendix.
Appendix, right? Good. (39°C) is a normal temperature for an adult.
I don't think.
20 degrees.
False. So normal degrees in Celsius. Actually, who can tell me normal degrees in Fahrenheit? 98.7-ish, like a little above, a little below. For Celsius, it's 37.
37.
37 is normal. We had somebody the other day whose temperature was 40 degrees Celsius.
Spicy.
Oh,
What term describes an allergic reaction that may cause difficulty breathing, swelling, and shock?
This opportunity to be here.
Anaphylaxis, good. I put a B up there because they sent me into anaphylaxis. What term describes the inflammation of the stomach and intestines? Good, gastroenteritis. Good job. Cerebrovascular accident, or CVA, is also known as what? Good job. So cerebral
Brain.
in the head, right? Vascular, meaning the veins, and then accident, apparently it's an accident, I don't know. Hyperglycemia and hypoglycemia occur in what condition? Good. So before you click, Billy, what is a transient ischemic attack? So transient means what?
Blood.
It comes and goes,
Mm.
right? It's not just there, it comes and goes. Ischemia means what?
Blood, something in the blood, white blood cell.
Lack of blood to the tissues, right? So transient, so lack of blood to the tissues that come and go. It's a mini stroke.
Oh,
That's all it is. It's a stroke whose symptoms go away within 24 hours of the initial onset.
interesting.
Does anyone know what epistaxis is? Nosebleed.
Oh.
So it's just a fancy name for or for nosebleed. Okay, you can click now. Thanks. The suffix plasia means what? So, hyperplasia. So, formation or growth. So hyperplasia would mean what?
Bone growth or
Too much growth of something on someone. Usually it's like hyperplastic, like heart or something. True or false? Hematoma refers to a collection of blood that's outside of the bladder. It's true. The reason I put a picture of a tomato up there is because it looks like a tomato up under their skin. I always call it a hematomato because that's what it looks like. What word would describe pain in the nerves? We talked about pain in the joints, right? So which one would be pain in the nerves? What something? Good job. Very good, very good. All right, this one should be easy. Got it twice now. Good job. So it is the kidney. So ren, like if you think like renal, right? Renal system is your kidneys. Which word would refer to both sides of the body? Good job, bilateral. Where's coronal? Front. Good. Good job.
Prefix to each.
The prefix cervix refers to which part of the body?
How many gentlemen know what that picture is?
It's not the
Gotcha.
cervix. It's not the cervix.
Gotcha.
You can't trust my pictures, folks. We learned this.
It's not cervical,
No.
like cervical.
So, like cervical spine.
Oh,
Yes, like your cervical spine up here.
7.
Yeah. I was like, oh, that sounds like cervix. I'm gonna put cervix in there and put a picture of it.
That's vicious.
You always have to be mindful of the picture.
Yeah.
Picture will get you every time.
Don't forget that.
Game's on. Which word means low oxygen?
That's just an excuse.
Really? Oh.
Hypoxic. So oxic, meaning oxygen, right? Hypo, meaning low. Other one, hypocapnic. What is capnic? Oh, we'll go next. Intercostal muscles are located where? Oh, you click too fast. You're fired. Intercostal muscles are located where? Good job. So between the ribs. So your costals are your ribs. So intercostals, meaning between the ribs.
We'll talk about this a lot when it comes to like breathing. You see that intercostal muscle use when you have breathing patients. So.
Scapula is another name for the shoulder blade. True or false? Good job. Scapula, shoulder blade.
Patella. Patella. My daughter, she's little, like they don't have kneecaps till they're like 3,
Yeah,
and she loves patella. That's how I remember it. Patella,
Okay.
patella.
I remember you.
Oh, you have a daughter.
Yeah, I remember you.
They lead with
Well, you
their
need
head
that.
always behind them too when they walk.
No, not my kid. My kid had a head forward. She had a noggin. That's what let her freaking march.
A sudden onset of something is described as what? Good, it's called an acute onset. So something happens like I got stung by a bee and I went into anaphylaxis. That is an acute onset of anaphylaxis.
What is? Yeah.
It's fun for me.
What is a chronic chronic low? Right, like cancer is a chronic condition, right? What about an exacerbation?
Going from one stage and then ramping up.
Yeah, so like COPD patients, you'll hear us a lot of times saying they're having like a COPD exacerbation. That means they have like a chronic issue with their lungs and now it's just exacerbated and so it's worse, right?
Last question. Hemorrhage means a runny nose. True or false? Good job. Good job, George.
And you can hemorrhage from your nose.
Yeah. All right. Let's see one. I thought that said Jim. I think I might need to get my glasses. Nice, number one.
I thought it was a quiz.
I think as you get more points. That's exciting.
So we'll do this a lot. We'll play Cahoots a lot. Especially on nights like tonight, like we said at the beginning of class, some nights we're gonna knock it until 7:30. right on the dot, 7:45. The other night, like tonight, it's 6:30. Right, so we're trying to find some voids and some space to fill. We'll do this a lot. Like we said, with the medical terminology stuff, start using it now. If, we come out to very cold, running cold, like, start using words. One thing I can tell you is, like, if you are ever around and we're around, I know me personally, Becca, Mike, if y'all want to get in the back of the truck with us and hang out, like do stuff, like we'll let you. We don't mind. So we don't fight.
Except CJ. CJ bit today.
CJ, spicy.
Where is he?
You just don't. CJ, it's just CJ.
Cool.
You just look past CJ.
Cool.
It's fine. Did he tell y'all couldn't get in the truck?
I asked.
I'll tell CJ to freak off. So I can do that. So yeah, if y'all ever want to jump in the truck, ever want to do anything, just let me know. I'll let y'all jump in the truck with us, do whatever. I'm cool with it. So learn this stuff now. There's only really a couple of things that'll really get you on that registry, and not knowing medical terminology is a big one because they ask a lot of questions in medical terminology or in medical terms. And so if you don't know what they mean, right, like Becca said, I've had questions like that in the middle of my exam when they were like, oh, this patient is suffering from this 16-letter word. And I'm like, oh, what that means. And so I'm like, eeny, meeny, miny, mo, and just pick one.
My favorite one's laryngotracheobronchiolitis. It's croup.
It's what?
It's croup.
What's croup?
Laryngotracheobronchiolitis. So inflammation of the larynx, the trachea, and the bronchioles.
So it's just all swollen.
It's croup. Yeah.
Croup?
Like
It's
kiddos
like
get
a
stuff
really
when they get that nasty little cold.
Yeah.
Oh,
They get real mucus.
Yeah, they'll throw that. They threw that one at me in paramedic school,
that's interesting.
or on my paramedic national registry.
Croup doesn't make sense, but does. Are you safe?
What is it?
She is definitely safe,
Oh, it's-
trust me.
Oh, it's the
She looks like this.
Yeah.
She grew up with a bunch of brothers. She will put you in a chokehold before you do that.
So is that just an excuse so you can beat your wife?
That's why I'm like half dumb now. Yeah.
Oh.
But yeah, if y'all need anything, reach out, let us know. Before we leave, we have one more assignment. So y'all are gracious enough to have this room. We're gracious. We have been grateful to be able to use this room. This isn't our room. This is the hospital's room. Tomorrow they have a hospital board meeting, so we have to rearrange this room and clean it up before we leave. That's going to be like a once a month thing that we have to do. So we'll get y'all to help us clean everything up before y'all leave.
Yeah, we should move some table around.
Yeah. It won't take but a couple minutes, but y'all didn't have to deal with the GBC bill.
The GBC building thing. Yeah, angry neighbor.
Oh, that's so
Yeah,
good.
they're real angry. Yeah. Yeah, post pictures of us on Facebook.
I